It's time for the Kim Hammer Show, where you'll learn how your state government affects you, your family, and community. Here's Kim Hammer.
Good afternoon. Welcome to the Kim Hammer Show here on 101.1 FM Live. Glad to see you watching on Facebook or listening in on Facebook Live. As always, we want to say thank you to our sponsors that help make this show possible. That would include Everett Buick GMC down at Saline County there on I-30 at the Alcoa Overpass. It's a great day to go shop for a new vehicle. Came by there earlier, and their service bay was full, and a lot of people out buzzing around on a beautiful Saturday. It's a great time to go take advantage of some of the incentives that they have for new cars, or if you're looking for a certified pre-owned car, it's a great place to go also to shop for a great used certified vehicle there at Everett Buick GMC down there in Saline County at I-30 and Alcoa. Then also we want to say thank you to Baxley Phillips Mowdy Real Estate. They are representing all of Central Arkansas. If you have real estate needs, you're looking to buy, looking to sell, that could be on the commercial side or on the residential, either one, or if you're looking for rental property, they can take care of you as far as commercial and also on the residential. That's if you are looking for a home to rent, but also if you have one that you want to rent, you don't want to deal with people, and you want somebody to help take care of it, that's a great place for you to go down there to Baxley Phillips Mowdy Real Estate, located there at Spring Hill and Highway 5 there between Benton and Bryant. And then also Edwards Cash Saver Food Stores and or just Edwards Food Stores in general. They're represented here in Central Arkansas, but also over in Eastern Arkansas. Actually, I was in Edwards this morning again and had the order called in and ready to do curbside pickup. I pulled in, called the number on the sign. They were out there within, it wasn't over 5 minutes. They were there out there with my order, and I was gone. And so if you want to take advantage of a beautiful day like this, you still got to buy your groceries, keep your cupboards full, but you don't want to spend a lot of time in the store. I'd highly recommend that you take advantage of their curbside service because it was quick, efficient, reasonable, and the staff was very friendly. And so it's a great place for you to go and shop and get all your grocery stores needs met. Now, just public service announcement. Generally on Sunday for the last 8 weeks, I've been bringing the message that I preached to the congregation I pastor, which is Saline Baptist Church down a community called Tull outside of Benton. But we are starting back our services tomorrow morning. However, we will have the service recorded and on air tomorrow at noon. The Facebook portion of it, you'll be able to go up to either YouTube or go up to salinenbc.org, and be able to catch the services delayed as far as Facebook or the video portion of it. But it will be presented here on the radio at noon. And then our church is hopefully going to set up to go be able to do our services Facebook Live, and I'll give you more information about that. So if you're looking for a way to worship, if you're not comfortable getting out in the crowds yet, you can join us tomorrow here at noon, and you can go up to our website and catch the services on there. Got some great guests lined up for the show today. We're going to start off with Christopher Dickie, who is the Director of Natural State Recovery, located here in Arkansas. And then in just a little bit, we're going to be joined by Dr. Corso. We've had Dr. Kent Corso on before. He is actually from out of state and affiliated with the National Capital Regional Behavioral Health System. And he was a guest. And if you want to go up on my website, which is thekimhammershow.com, you can just type in Dr. Corso and you'd be able to pull up his information. And what we're going to talk about today is about the effects of COVID-19 on society, looking at the suicide rate, but also looking at the addiction rate. And so first of all, we've got Christopher Dickie joining us on the phone today. And Christopher, thank you for joining me on the Kim Hammer Show.
Glad to be here, Senator. Thank you so much. It's always a pleasure being on the air with you.
So first of all, let's talk about how things are going over there at Natural State Recovery, because you recently purchased the old Oak Grove school and started a remodeling project before the COVID-19 moved in. Also, just give everybody kind of an update on how things are going over there at Natural State.
Absolutely. I got to say, it's been a whirlwind. It seems like we're still kind of waking up in a new world each time we blink. If you remember, we bought the campus in late 2019 and had a groundbreaking on March 12th. If you remember, that was when we had just learned that we had our first positive COVID-19 case in Arkansas. The governor, attorney general, and many other folks were at the groundbreaking. In fact, 1 hour after the groundbreaking, the governor was doing his first of many press conferences and talking about the pandemic and how our lives are changing and what are the guidance to stay safe. And so it's delayed progress a little bit out there. They are back to working now that we've been able to put some things in place to keep the workers safe and to make sure we're progressing at a rate that everyone's comfortable with. I got to say, though, I mean, in terms of keeping our outpatient facility open, has definitely been a challenge. We not only have enacted, just the mandatory temperature checks and a few survey questions on staff, clients, any visitors coming in about, to follow the guidance on contact tracing and figuring out where a person has been. We still continue to do that to today. It's important that we remain open, and we're going to get into more reasons why it's important for us to remain open later in the show. But we're operating. We're still taking new clients. We're still meeting face to face. We there's a ton of research that supports that the human connection is a critical role in a healthy lifestyle. We want to avoid isolation, especially for people who are in active addiction. They need connection. And so early, for the people that are coming in early in recovery, we still are open and meeting with them. Now, the people that don't need that high level of care, we have transitioned to telemedicine. You're probably familiar with all of the rollouts with counseling and things of that nature. Addiction medicine is where we're at, and we're able to offer telemedicine to clients that have a stable environment that can still attend our program from their living room.
So let me ask you, one of the things with you having your experience in addictions, with the COVID-19 and all the impact that it's having on society because life is upside down, are you seeing an uptick as far as addiction abuse, and is that any way, shape, or form directly related to the ongoing COVID-19 situation?
So absolutely an uptick. Our phones are ringing off the hook constantly with people seeking help, which is that's a good sign. The ones I'm worried about, and I think the doctor that's coming on, I'm looking forward to having this discussion with all of us. The people that aren't taking those steps are at real risk of either continuing the active addiction and spiraling out of control, or engaging in suicide, which is obviously something that is devastating, and we do not want that to happen. I'm going to read you this quote from a doctor. His name is Timon L. Cermak, and he says it perfectly for what we're kind of dealing with. Isolation becomes a weapon and a solution, then a prison. Social isolation protects one's secrets and puts Miracle-Gro on addiction. Isn't that powerful? Isn't that a powerful statement?
I'd say that's the voice of somebody that understands what's going on.
Yes. And so, while we're practicing physical distancing, social distancing, the act of social isolation is the killer. That's what we do not want to have. And so I wrote an article that was published in the Democrat Gazette recently that talks about, maybe the only connection right now is an internet connection, and going to support groups that have transitioned online, taking steps to stay engaged, still being able to find support and accountability for people in recovery, even like myself. I rely on support and accountability. And so I've got to stay engaged somehow.
You talked about the connection with people. Do you feel that the longer that this continues to go on, as far as the limitations that are, although we do start to see it opening up, and I understand that there's pressure to get this thing opened up to where we can have a little bit of normalcy. But as far as the impact of keeping things shut down, when do you think it is that we go from the point of that the disease itself is bad enough, but the consequences of trying to negotiate around the disease become as great as the disease itself because of the impact that it's having on society, and especially people that are dealing with substance abuse or, suicidal thoughts?
Well, you're absolutely right that people in recovery rely on human contact. And so the longer social distancing is needed, the more strained people feel. And those struggling may or may not reach out. And they may just be in this kind of, treading water and really not know what resources to reach out to. And so it becomes this compounding problem. As far as, the truth of the matter is, it's no secret that before the COVID-19 pandemic, our nation was fighting a different public health emergency, and that's addiction. And while the coronavirus pandemic is challenging millions of people who are struggling with drugs and alcohol, it's also impeding the progress we've made as a country in the opioid epidemic. And so those things are, we've got to multitask here. Obviously the COVID-19 illness is something that we have to be cautious and smart about. We also can't, addiction doesn't stop, and we can't afford to stop the progress and the efforts either in providing solutions to people who, when they do reach out for relief, we've got to continue to be there. Now, the question of what you asked is where do you draw the line? And I think what we're dealing with is just kind of triage. We're triaging the situation. When people come to us, they're beat up, they're broken, they're in this kind of bankruptcy emotionally, spiritually, physically, and mentally. And we're just doing our best to meet them where they're at. And unfortunately, our organization and the advocacy work that I'm involved in doesn't really help to open businesses or open America back up. So we're hoping that people are that are in leadership roles have the discernment to make those decisions, but they can't not think about the suicide rates and the potential overdose rates that we could be facing as a result of staying closed.
All right, so let me ask you this, and then I'm going to preface it by forewarning. I'm going to ask you about suicide rates, and are we seeing an uptick in them? So yesterday I did a funeral service for a 95-year-old gentleman. He was on the USS Essex, and he was in World War II and dealt with some, traumatic situations being on that ship and the things that go on whenever it is that you're in war. Came home, resumed, a degree of normalcy, had 4 kids, worked at, Reynolds metal plant, and had a great life, lived to be 95, took care of his wife when, she was dying, and was right there at her bedside. Just that greatest generation. He was part of that greatest generation. They seem to handle things differently than people handle it today. And so we got this COVID-19 virus that has basically, for our degree of normalcy, turned the world upside down. Are people just not as tough today to be able to handle it the way somebody like that gentleman was able to handle it? And are we as a society, have we become so soft that the least little thing that happens that disrupts our schedule just kind of sends us into a tailspin? Just talk about that for a second.
Yeah, that is a perplexing question. I think that I look at it from the perspective that obviously addiction does not discriminate, doesn't care who you are, doesn't care if you're weak, tough, race, religion, celebrity, poor, doesn't matter. I think what recovery teaches us is to develop a certain lifestyle and engagement in certain principles that allows me to deal with things that used to be baffling to me or used to be, seemingly impossible to overcome. And so that's the good news. That's the hope of recovery, that we are able to withstand certain things. I've got to say, too, some of the reports I've seen is, a lot of times when someone's in active addiction, they have some comorbidities, right? So they're also dealing with depression, they're dealing with anxiety, they're dealing with these other disorders that kind of compound the challenges. The pandemic is, you remember seeing that, alcohol sales were increased by a large percentage, just people, scrambling to try and cope, whether it's healthy or not. Just people were trying to cope with this new environment, this new atmosphere that we are in, and trying not to engage in that panic, right? And so I don't know, each person's different. Each person deals with things in a different way. I don't think there's a manual. There's a lot of guidance on how to protect oneself, but I don't think there's a manual for this. And I think that's why you're seeing a lot of people sometimes fall apart. I will say this too, that the crisis, or any crisis, brings out the best of us and the worst of us. And I think we've been able to see that lately.
And so as far as people having a little bit difficulty coping with this, what are you seeing as far as the uptick of the suicide trend, and how much can you justifiably attribute to the COVID-19 situation?
Yeah, so there's understandably so. We are facing an unprecedented unemployment. We are, seeing a tremendous loss of life, a lot of grief, and then you would add the current state of affairs in America with the rioters and protests and the pain that America is in right now. And I will say that prior to the pandemic, when it comes to suicide rate, from 1999 to 2016, Arkansas experienced an increase of 37% in suicides. And then you have, in 2017, there was around 631 suicides, which made it the leading cause of violent death in Arkansas. And you have, health officials, public health officials, trying to find a way to prevent these deaths, but sometimes they're very, very hard to identify in people. And so we have a Let's Talk About It campaign that was done by a partnership between the Arkansas Department of Health and the Attorney General's office, which, I'm not too familiar if that's still going on, but it was a big part of, just raising awareness. You have these walks that are engaged to raise awareness. But I think it's important to try and find the root cause of that. And while, those numbers were pre-pandemic, I can certainly tell you that they have increased during the pandemic, because we're seeing a compounding challenge in people's lives that are vulnerable and susceptible to increased in anxiety, increased in depression, and the more someone isolates and withdraws from support, the fact of the matter is it's just a continued dark place for them, and it becomes harder to reach out, harder to be honest with what's going on.
So we're waiting for Dr. Corso to call in. I'm not sure if he's had technical difficulties or what. We're reaching out to him to come on. But let me ask you this. What do you tell somebody who's struggling, they've lost their job or the uncertainty of the future? How do you give hope to somebody that is feeling like the walls are closing in on them and their life as they knew it beginning back in February is no longer the same? how do you give a person a pathway forward to where they don't feel like this is the end and they can see past it?
Well, I think that that's a very good question. I think that it's important for agencies, organizations, people to be a lighthouse for somebody that is trying to come in out of the rough waters of despair and hopelessness. I think that you know, just being blunt and asking, if you see somebody that you know is struggling, say, are you thinking of suicide? That's a tough question. That's a tough question to say. But I think, it goes a long way to creating a safe environment for someone to be able to open up and be vulnerable. But like I said, I think that continuing to talk about it and just straight up asking somebody, are you hurting? What is going on? Tell me, and pushing a little bit. And, I've got a lot of people in my life that I'm grateful for that cared more about my life than hurting my feelings with a tough question or a statement to me. And so I think that it's important to note that if you know somebody that is struggling, if you know somebody that's been out of work for a while, that is having a tough time, reach out to them.
When Dr. Corso was on the program before, one of the things we talked about was about the fear to talk about death, because people confuse talking about death necessarily associated with talking about suicide. They can't draw the line between the two. And the reality is that those thoughts might go through a person's mind, but that doesn't necessarily mean that they're contemplating suicide. But as you said a while ago, being more concerned about being direct than worrying about hurting your feelings at least gets the conversation out there to where the dialogue can occur.
Because you're absolutely right. So they may say, no, I'm not. I'm just, I'm just in a funk. I'll be okay. Or they may say, yeah, I've been actually planning. It's Wednesday, and I was planning on doing something to myself on Friday. And you could be the person that opened up the dialogue that led to saving someone's life. And so you're absolutely right.
What about from a spiritual side? Give it to me. I mean, there's the practical tools about, you talk about, agencies, and we can get, 800 numbers and get them up on our website, and people can be able to go there to get that information if they know somebody, or if they themselves are thinking about it. But just give it to me from a spiritual perspective. What would you advise somebody on the spiritual side of things? Because I don't think you can deny that while we've got to deal with it from a practical point of view, we also have to deal with it from a spiritual point of view, because we are, created in the image of God, and we do have that spiritual and emotional side about us. How do you, or what tools, or what do you equip people with as far as how to take it from a spiritual angle?
Well, for me, I know that I can't live this life alone. We weren't designed to. We were designed to be together and lift one another up in the eyes of God, and in order to share that glory together. And so when something happens, and I've been through a lot of stuff as you have too, where the only way I was able to get through it was because I leaned in to my support. I leaned in to my Heavenly Father to bring me that peace, that calm that only He can bring during moments of chaos. There's a person that taught me this, and I love this quote, and I still live by it on a daily basis. And it's kind of like a barometer for me to know if I'm practicing my own will, or if I'm in practicing seeking God's will. And it's God is the author of peace. God is not the author of chaos. And I love that, because it allows me to sit back and look at, like, okay, if I'm internally feeling chaotic, what am I engaged in? Where are my priorities? And a lot of times then I can put things in perspective and start to, put my energies and efforts into the things that bring me comfort, which is, seeking God's will.
Well, and some churches have started meeting back, and we're going to start back tomorrow with the church that I pastor. And, there is, I think, going back to where you started the conversation about people being isolated, people being disconnected from their social groups. While church should not be a social group, it's a spiritual group that socializes while they're there to worship the Lord. There's a big benefit, I think, to people being able to gather together to worship and be able to, as you said a while ago, find that time to spend worshiping God, who brings peace in the midst of the confusion, the chaos. One of the things I would offer up is that if you do not have a personal relationship with Christ, or you do not have a belief in God, you are isolating yourself even further from God, who can help you through all the challenging times that we're going through, because some things we don't have any control over, such as, when are we going to be able to get to phase 2 or phase 3, and those things, a lot of which are out of our control. However, that doesn't mean you can't have a personal connection, a personal relationship with God, who is there for you 24/7. And while you may not be able to reach out and touch him, like reaching out and touching a laptop or a phone number, or having that kind of interaction with somebody on the other side of on the other end of the line, there is, God has that ability to bring a peace within your heart that nobody else can, that gives you that sense of, okay, it's not what I like, but at least I know it's going to be okay. And ultimately, when we do die, not at our choice, but at our appointed time's choice, we know we've got a place called heaven waiting for us. And to me, that's one of the things I find comforting about having a personal relationship with Christ and with his Father, my God, is that he gives me that reassurance and that security in a very insecure time. Chris, can you hang on through the break for just a minute, and we'll wrap it up on the other side of the break?
Sure.
All right. So what we're going to do is we're going to take a break here on the Kim Hammer Show, and hopefully we might have Dr. Corso. We're trying to reach out to him to make sure he can get through. And if not, we've got a couple other guests that are going to be on in the last half of the second half of the show. A couple small business owners that deal with venues, such as wedding venues. Maybe you're an individual that had a wedding plan and you're wondering whether to cancel it or not, or you've got a big event, you're wondering whether to cancel it or not. We're going to talk to a couple small business owners that have been directly impacted by some of the decisions that have been imposed by the government, and we're going to get some insight from them. But when we come back, we're going to pick up with Chris Dickie, who is with Natural State Recovery. Thank you to my sponsors, which would be Everett Buick GMC down there in Saline County, also Baxley Phillips Mowdy Real Estate, and then Edward Food Stores here in Central Arkansas. We'll be back in a couple minutes on the Kim Hammer Show.
Take The Answer with you anywhere with our free mobile app, 1011fmtheanswer.com. Tune in, iHeart, or radio.com. Breaking news and stimulating talk. 101.1 FM, The Answer.
There's no better time than now to start looking at your health, life, dental, vision, Medicare supplements, and options for long-term care insurance. Every few years, we all need to evaluate our coverage and look for the best coverage and rate. Art Wilborn Insurance is an independent agent that is contracted with several insurance companies and able to provide more options for coverage for you. He has a support team with 30 years of experience and is local to Central Arkansas. Give Art Wilborn Insurance a text today at EASY to 474747. That's EASY to 474747.
Hi, this is Pat Davis, your healthplanman.com. One definition of insanity is doing the same thing over and over, expecting different results. I can't argue with that. I used to sort of coach my son playing video games. He'd go through the same door, get killed by the same monster waiting him every time. I'd say something like, son, if you go through that door one more time, I'm going to kill you. We had some good laughs. So here's a new take on insanity. Imagine going to the car lot and buying a new vehicle. 6 weeks later, you find out the price. How crazy is that? Guess what? We just perfectly described receiving health care in America. You have a service provided, don't know the cost for weeks. Or maybe it's just paying more than you should every month and paying co-pays and deductibles, and then the insurance company pays. It's all part of the same insanity. Not for my clients. They receive checks after going to the doctor, no money out of pocket. One client, after getting bit by the neighbor's dog, said he was going to bite himself and go to the urgent care, where he received a check for almost $500. Bill paid in full. Call 501-605-6935 or go to yourhealthplanman.com and I'll show you how to stop the insanity.
Van Jones talking about the white woman in Central Park who called 911 on the African American who threatened her. Van Jones says, forget about the KKK. It's white liberal Hillary Clinton supporters we ought to be worried about. Wow. Donald Trump called racist, what a shock, for using the word thug. Guess who else used the words thug? Barack Obama, Joe Biden. None dare call them racist. On the next Larry Elder Show.
He's known by many names.
The Maharashtra and El Rushmore and the Doctor of Democracy, Truth Detector, harmless, lovable little fuzzball.
Yes, all those things and more.
A man, a legend, a way of life.
He's
Rush Limbaugh. Ready to sizzle, my friends? Are you ready to cook? Well, we're all in the kitchen, and we at the EIB Network are in control of the thermostat.
The Rush Limbaugh Show, weekdays at 11 on 101.1 FM. The Answer.
All right, back to the Kim Hammer Show, and hopefully we'll be joined here by Dr. Corso for just a second. But we have on the line with us Christopher Dickie, who is with Natural State Recovery. And Chris, as we go back into the second half, Dr. Corso is going to be joining us on the line here in a second. So, Dr. Corso, are you on the line with us today? Hey, Dr. Corso, can you hear us? Oh, are you there, Dr. Corso? Hey, there you are. Hey, thank you for taking time to join us. We've got on the phone with us a gentleman named Chris Dickie, who is the director of Natural State Recovery. I guess, Christopher, how would you describe your place?
We are a substance abuse treatment center that specializes in the full continuum of care from crisis to sustainability. We've combined clinical treatment, non-clinical treatment, recovery housing, and life skills training for a full transformation.
And Dr. Corso, what we were talking about before you called in was about the impact that COVID has had on society, and specifically how it maybe is connected to the increase in suicide rate. Just curious if you could just share a few ideas as far as what you see, because this is an area of expertise I believe that you have, and it is always a concern whenever somebody chooses to take their life for whatever reason. But are you seeing a direct correlation between the COVID-19 situation and the suicide rate nationwide, or just bring it down to the local level?
So locally and nationally, I haven't seen any clear data yet that the suicide rates are increasing, but what we have seen are clear signs of the risk factors for suicide increasing. So what does that mean? It means all those things that happen to people in life, things like stressors, whether they are relationship problems, job problems, legal problems, stress, things like that, that often are the events that trigger people, and then they start thinking about death or dying or thinking about suicide. So, for example, domestic violence is something, and substance abuse. You said, Chris Dickie, sounds like you run some treatment centers, recovery centers. So I would imagine that your centers are busier or will be busier in the next few months, because if people are locked down and there's no way to get out and de-stress or decompress, and if pressure just increases, people's sort of worst coping habits will come out. And whether that is domestic violence, whether that's substance abuse, sometimes people just don't cope in healthy ways.
So let me ask you, Dr. Corso, one of the things that we battle with here and nationwide is the debate over when to open things back up, because people are staying bottled up. Do you have an opinion, or what are your thoughts as far as it better to keep things locked down? And I know that involves a degree of medical, perspective, but from a mental health provider's perspective, this is what I asked Chris earlier. What's the balancing line? When do we get to the point that it'd be better to open things back up and deal with what might be the medical consequences versus the toll that it's taking on society from an emotional perspective? And what rational connection can you make between the two to where we could get the best of both worlds? We would.
Yeah, I think the best of both worlds is what we're starting to do with opening up slowly and in phases. We can't stay closed forever. It's not healthy. It's not constructive as a world economy, as a local economy, as just a community. There's that old saying that no man is an island, and people generally need other people, whether it's family, whether it's church or spiritual, or whether it's just community. So I think the gradual opening up, and different states are handling this differently, but each state has its own logic and its own plan, and that's an important thing. We can't stay closed forever. Remember that unless we had a treatment for this, if we had a very effective treatment for COVID-19, then it would be okay to stay shut down, treat everybody, or at least inoculate everybody if we had a vaccine. And then we could just open up very quickly, but we can't do that. And so sort of balance is the name of the game. There are going to be more people, even as we open up, who will get sick. Hopefully we don't see this in spikes. Hopefully it happens gradually.
I know one thing that you do is you analyze for Johns Hopkins University, even right here in Arkansas, some of the COVID-19 data. What are you seeing from the analysis work that you've done that you think would maybe give indication that things are turning downward, or what would you like to weigh in and share along that line?
Sure. So I look at the way I look at these data. I'm using the Johns Hopkins database, which frankly a lot of states are using, and most countries are using it actually. And what I look is how fast things decelerate or accelerate, because that gives me a better prediction of what's going to happen next. Now, one important point to put things in perspective is none of these data sets are perfect. There's a lot of different criteria people use to when we're talking about who gets the COVID tests to just check to see if someone has it. When we look at who gets the antibody test, a lot of people are using different criteria. You also have different criteria for death. There's death associated with COVID. There's death due to COVID. And then there are a whole bunch of people who might die, and they don't give them a COVID. They don't do an analysis in the morgue necessarily. So the first thing out of the gate that we have to understand are that the data are pretty fuzzy. Actually, they're not crystal clear. Having said that, it's really the only thing we've got to go on. and actually, if you do look at COVID data, I'm actually looking at it right now. In the last 2 weeks in Arkansas, it still is accelerating gradually. Now, it's been gradual for the last 4 weeks and almost constant. And when I say constant, that means we have the same number of cases today as we did yesterday. So we're not out of the woods yet. Whatever we're doing, we need to keep doing it. But this is not something that just goes away fast.
And as it progresses and goes longer, last weekend here in Arkansas, we kind of had the lid lifted a little bit for people to be able to start getting out. Of course, you had the pictures of people that were congregating on the shorelines where you had like 20 boats lined up together. And, sometimes you got to wonder how much of that's Photoshopped and how much of that's really real. But there's human nature that just says once the lid comes off, the tendency is to want to get together and just be able to participate. How do you advise people as far as, look, just because you got the freedom doesn't necessarily mean that you need to take advantage of it to the full extent. And I guess I'm wondering, back to what you said a while ago, if we're not seeing necessarily an uptick in the suicide rate directly, but you're seeing the warning signs on the front end of it, how far out would you project that if things don't open up, that people would, that suicide number might actually then start going on the uptick? Or can you even do that?
Yeah, I don't know of any way to do that. Our ability to predict suicide at population levels and state levels is pretty poor, according to the last 50 years of research. We just don't have systems that are that accurate. Human decision making is a hard thing to predict, isn't it? So, but what I can say is that back to the first question you asked, which is how do you balance this as we open up and people are feeling like they just need to cut loose and just need to really get out and breathe fresh air and be around others. I'm a proponent of that old saying that if you treat people like children, they act like children. And if you treat people like adults, they act like adults. And so I think the key is to try to help people understand that the slower they re-engage, the better. The faster they re-engage, the more risk they're taking. But I think we have to empower people to just keep some guidelines in their minds, like not having a congregation above 10 people, trying to still wear masks and use protective gear. But the reality is, I think some people are getting a little cabin fever, for lack of a better word, and getting frustrated and feeling like this is an issue of liberty. And I think if you think about it that way, it can really, really get you spun up. But the issue is about safety and safety for fellow Americans, fellow Arkansans. And if we're willing to sort of pitch in as a group and as a community and if we're treated like adults here and we're given some leeway and some judgment, I think that people will make the right decisions and sort of try to keep things opening slowly.
Very good. Well, gentlemen, I hate to let you go because it's been good, but perhaps we'll be able to get you back on. But I've got a couple other guests I need to get to that are small business owners, and they're going to bring the perspective of what they're having to deal with, with the lockdown the way it is. But Dr. Corso, I appreciate you very much taking a few minutes to call in, and we'll get you back on the show down the road to talk about other things. And I appreciate you calling in. And as always, Christopher, thank you for calling in and taking time on the Kim Hammer Show today. That's been Dr. Kent Corso. And you can go up to my website and see information on him and also access some of the materials that he has to offer. And then also with regards to Christopher, you can we'll get Chris to get us some stuff so we can get it up on our website so you can know he is a great resource to go here locally over at Natural State Recovery. Especially if you are dealing with some of the issues that we've been talking about the first half of the show, he would be a great resource to go to. So both you gentlemen, I appreciate you all being on the show today and look forward to having you back on. Before we go to our next two guests, which would be Serge Kakorian, who is with Vibrant Occasions. They are catering service, and we've got Joe Snell, who is with Central Arkansas Entertainment. I want to thank my sponsors, which would be Everett Buick GMC, down in Saline County, then Edwards Food Stores, whether it's Edwards Food Giant or Edwards Cash Savers, and then also Baxley Phillips Mowdy Real Estate. All three of those companies are great companies to do business with. If you're looking for a car, you're looking for groceries, or you're looking for real estate, those are three great individuals, companies for you to go and participate with. All right, now online, I have Joe Snell, who is with Central Arkansas Entertainment, and also Serge Kakorian with Vibrant Occasions. And gentlemen, welcome to the show this afternoon on the Kim Hammer Show.
Thank you. Happy to be here, Kim.
It sounds like y'all might be working with the background noise. Are y'all at work?
Yes, sir. I'm actually in my kitchen, and no, I don't have any. I'm hearing a lot of feedback, though.
That's all right. That means somebody's busy. Hey, so let me start off with you, Joe. You're with Central Arkansas Entertainment. Tell the folks what Central Arkansas Entertainment is.
Sure. So we have a team of DJs, 16 DJs here out of the Central Arkansas area, Little Rock primarily. And then we do sound, lighting, and video. We do full production, basically, for events. So, even like on vote night at the Embassy Suites, we'd be the team that comes in and sets up all the stage, sound, lighting, all that for large-scale events as well.
All right. And Serge, tell us about Vibrant Occasions real quick.
Vibrant Occasions has two brands, Dinners Ready Catering Express, and we also have Vibrant Occasions Catering. And basically what we do, anything from a small drop-off service, like a 10 count for a corporate meal, all the way to the other side, Vibrant Occasions, which does weddings, events. We do plated meals up to 800 people or 1,000 people, no matter what it is. We try to basically we boutique, we customize things for our customers.
Well, I know because I've worked with both y'all in your respective settings. Some of the weddings that I've done, you all have both been there, and just some of the other events. And with regards to, let's start off with you, Joe, as far as the shutdown because of COVID-19, I know y'all have participated in presenting to the governor's office, Department of Health, some proposals when the original recommendation came out of groups of 50, and y'all worked well with the venues in order to be able to bring a more realistic perspective to what could be done. Just give the people an idea about, Joe, how this has impacted the folks that you serve, and give a little perspective from a small business owner.
Sure. So obviously we deal with countless brides. Brides and grooms are probably, I'd say, 85% of our business. And really, it's twofold. Obviously, we're looking to get into phase 2, and because like any bride, they want that number to go up. They want that capacity number at a venue to be able to go up so they can have that special day. And then the other part is the fear. I mean, we're dealing a lot with our clients are afraid to have an event. And until, it's almost as until America is ready to get back to work, I'd say. And you hate to say some sense of normalcy, but a new sense of normalcy, it's going to be hard for us. We have a long road.
When you talk about the fear, is it the fear because maybe they are the fear of having to schedule and reschedule and all that goes with it, or is it the fear that they're going to have 200 guests and somebody's going to get infected and it's going to be blamed on them, or what kind of fear is it that they're dealing with exactly?
I think it's more the fear of how the government is going to handle them having an event. And it's the fear of the virus, obviously, but right now you have small businesses that are literally afraid to open their doors, restaurants that are being told, if everybody in your restaurant doesn't have a mask on, then we're going to come in and shut your doors. And, but here I am standing in Walmart, and there's 1,000 people in here, and 700 of them probably don't have a mask on. That's, it's the reality that we're in. And, it's hard. It's hard when you have these small businesses that are suffering, and yet we look at the large box stores and we wonder why.
Well, and that has been the challenge, I think, is the inconsistency of application of the rules, that one entity gets treated this way and another entity gets treated this way, and there's not a connection as far as the fair play rule, if you would, between the two. So, Serge, let me ask you, from a caterer's perspective, how has all of this impacted you?
Us personally, we've pretty much lost 90% of our business right after March 13th or 14th, all the way till end of May. Now, with the relaxation of once the 1/3 came through, we're starting to see at least June not cancel as much. But we're in such an industry, Cam, that people are planning 2-3 months ahead, and people are under contract. Most of our clients are already been on contract all the way from last year. So as soon as we get close, and as long as they don't hear anything from the government saying, hey, we're going to open up restrictions, they're getting very nervous. We're starting to see a lot of cancellations in July now, and also some in August.
Yeah.
Well, and give people a little bit of an idea. It's not just affecting Joe and Serge. Joe, give people an idea how it affects the people that work with you and the wide range effect it has.
Oh, absolutely. Okay, so I mean, realistically, we have 25 people 25 to 30 under our banner. This is under Central Arts Entertainment. In any one wedding, you could easily have 9 to 12 vendors. So you're affecting literally hundreds, if not, 1,000 people, hundreds of families you're affecting through one wedding, one large scale event. And my heart is these small businesses, if they were given the opportunity, they would follow directives in a heartbeat. They want to follow the directives. They just want the liberty to be able to open their business.
Serge?
Kim, I'm going to add something to what Joe just said. Me personally, as us as a business, we do have employees. So we were able to get the PPP. We were able to get EIDL. But a lot of these venues and a lot of these, they're small family-owned businesses. They don't have employees, and they did not get any aid. So therefore, we're starting to see all these companies suffer so dramatically. It's heartbreaking.
So talk about, because both of y'all worked very well as far as recruiting the venues to bring some suggestions to the Department of Health about how you could provide your services and do it in a safe manner. I've got about 5 minutes left. So talk about some of the things. What if I was to have an event with you? What would be some of the safety features you'd have in place to where I could come to that event and know that I've got as good a chance of staying healthy as I would being in the Walmart wherever Joe is now with a bunch of people around him that he doesn't know?
I let me take it. I got a surge. So,
you got it.
So at these events, we from the time you're coming in the door, we have the directives on the outside of the door, hand sanitizing stations as soon as you come through a door. People are anybody over the age of 10 or up is being asked to wear a mask. The tables are 10 feet apart with the chairs being 6 feet spread in between chairs. Every directive, and then the catering side, the catering, Serge is handling the catering, and 99% of these caterers are handling it better than even your restaurants are handling it. From plexiglass shields, the clients, the guests not touching their own plates literally until the food gets into their hand, and then the guests are throwing their own plate away. We just need that opportunity. We need the governor to come out and say, hey, it's all right for you to go ahead and do a wedding. We need hope. Go ahead, Serge.
Oh, what we did, Kim, just to let you know, we ran a mock wedding. And the reason we did that to see what kind of, what can we learn from this? But it was Central Arkansas, myself, a bunch of wedding vendors from across Arkansas. We did a mock wedding. We actually set it up where, how do you deal with social distancing? How do you go to the buffet? So we learned so much from it, and we actually implementing it. We've done one wedding last week, and we're going to do two, and it was picture perfect.
Well, and I think, that's the one point I want to stress is the one thing, and listen, I'm in government, but I'm also civilian. I can, step on both sides of the line when I say this. Some of the best solutions don't necessarily come from government. Some of the best solutions come from the people that are directly impacted by the things that we decide as a government and then impose upon you. And I know that both of y'all have worked together hard in order to bring about some common sense and practical solutions to where the public can feel probably safer because of the resolutions to the challenges that y'all have brought. Because you, like so many other small businesses, and we're not talking big box, we're talking small businesses here, you need those clients to feel safe to come into the environment that you're hosting. And that is one of the things I want to stress, that if you're out there with the venue, the idea of canceling should not be your first thought. The idea is that if you come into a venue such as, by Central Arkansas Entertainment or Vibrant Occasions or other quality ones that are out there, and there are hundreds of them out there, it is a safe environment to go into, more so than if you go into a big box store where there's no enforcement at all.
Yeah.
Okay, right. I can give you all about 15 seconds each to say final word. So let's start with you, Serge. Last thing you want to say?
Man, we're ready to start the business back up again. We want to do it safely, and we need that economy moving.
All right. How about you, Joe?
Same with Serge. We have our PPE ready, and we're ready to see our nation and our state as a whole come together and move forward.
Very good. All right, so let me say this in closing on this one. You've heard from a couple small business owners that have been directly impacted, of which there are hundreds of small business. And when I say small business, I'm going to limit it to 50 and under. One of the things we need to do is support our small businesses, and you can go into an environment. If you got a venue scheduled, you got an event scheduled, before you just up and cancel it, talk to your caterer, talk to those that are going to be organizing, because you may find out that you're going to be safer there than you are in a lot of other places that you're probably going into already. So take care of these people, support them. This has been the Kim Hammer Show today. I hope that you felt that the time you spent has been valuable. I want to say thank you to Everett, to Edwards, and to Baxley Phillips Mowdy Real Estate, our sponsors of the show. Hope you have a great rest of the day. You've been listening to the Kim Hammer Show.
101.1 FM, The Answer. KDXE FM, Kamak Village, Little Rock. A Salem Media Group station. 101.1 FM, The Answer.